Classics 107.9. Time to check in with our dear friend Dr. Monique Gary on a Friday. It's the weekend, Doc. How are you?
It is the weekend. I'm hanging in there. I'm watching what's happening in the world, and I'm sending up a lot of prayers. I tell you that much.
Yeah, girl. It's a time to be concerned. I know a lot of people are getting antsy, and they're seeing these soft reopenings, and some people are getting back to work. With all of that said, I have a couple questions. Number one, if you have an elective surgery coming up, should you be tested, or do you have to be tested? Number one. And number two, as people are going back to work, should they be tested first before entering back into the workplace?
All right, so let's start with your first question, which is if you're getting elective surgery, most institutions are requiring you to test negative. They're telling the patients to go through different drive-through services. I know at my hospital, we're requiring every patient to have a negative test within 48 hours. So 2 days before surgery, they have to go and get swabbed. The test comes back in a rapid fashion, and if they're positive, their surgery is canceled or postponed. So yes, if you have elective surgery, chances are, even things like dental work, eye surgery, chances are you're going to be required to have a negative COVID test and to prove that you're negative. For people who are returning to the workforce, it really is very office and very job specific. I think it's a great idea to test people as long as there's an availability of testing kits. If you can still go through drive-through at CVS or someplace and get testing, I think it's a wonderful thing to do because then you'll know your status and you know that you are not infecting other people who might be at higher risk than you are. So I think it's a great thing, but it really is policy by policy and institution by institution. Now the question is, if you do test positive and you haven't had any symptoms, what are your options? What should you do? And so there's two options that are, one is a time-based strategy and one is a test-based strategy. So if you're using a time-based strategy and you test positive, you need to quarantine yourself at home for at least 10 days, preferably 14, but at least 10. If you develop symptoms, then the clock has to start all over again. But as long as you're asymptomatic, you can wait about 10 days or so. If you have not had any symptoms and you need something like a surgery, then you need to retest. The results are really variable about this, but you need 2 negative consecutive tests more than 24 hours apart. So let's say you're having a procedure. The week before that procedure, you need to get tested on a Monday and on a Wednesday, or on a Wednesday and on a Thursday. You need 2 negative tests at least more than 24 hours apart in order to be considered truly negative. The tricky thing is that, we can virally shed. You can shed the virus for at least maybe up to 6 weeks. And that's the tricky thing. If your surgery gets rescheduled, you probably should wait at least 6 weeks because you may test positive again. It doesn't mean you're reinfected. You could just be shedding the virus. If you live with someone who tests positive, you've got to wait 14 days. So they might be able to go back outside after 10. You have to wait 14 days because we need to make sure that you don't develop symptoms.
All righty then. That's a lot. You know what? I think I'll just put off my dentist appointment a little longer. I think I'll just stay put.
Good to know your status, but if you test positive, chances are you should wait about 6 weeks to do any sort of procedure, because you have to retest, and the retesting could be positive again. It doesn't mean you're reinfected, though. And again, if you're asymptomatic, then you're doing just fine. Continue to hydrate and boost your nutrition and try not to worry.
All right. Well, there you have it, ladies and gentlemen. It looks like we are a long way from getting back together, but you know what? We're going to stay prayerful. We're going to get through this together, like you say every day, Dr. Mo, and this too shall pass.
That's right, and it's the weekend, so everybody enjoy it and stay safe. Love you guys.
Love you more. It's Classics 107.9. Testing. That's all I can say. There are so many sites offering tests, whether you are having symptoms or not. So please, if you feel like you've been in contact with someone with COVID, please go get tested. We're going to take a break, pay these bills, and we'll be back. Love you, Doc.
Love you back. Take good care, everybody.